Good morning, everyone. It's 10 o'clock, so we're going to get started here. Happy Wednesday, everyone. Welcome to Lifelong Learning. I'm Wendy Linow, Vice President this year. Donna can't be here this morning. Our members enjoy many benefits, as you can see on this slide. Take a minute to read the list. These are just some of what you would gain by being a member. And John and Sue are happy to take your membership back in the back. As you can see here, the views expressed in any of our presentations are those of the presenters, commentators, etc., and may not reflect the views of the leadership of SCA Lifelong Learning Club or Sun City Anthem, nor do we endorse any products or services by anyone who comes here to make presentations. I'd like to now introduce Juanita Brown, our wonderful program director, who will introduce today's speaker. Juanita? You're welcome.
Good morning, everybody, and welcome to Lifelong Learning. It's so nice to see your smiling faces out there. Today is really a special presentation. This is stuff that we all need to know. And Dr. Cora Spaulding, who's going to do the presentation, is a real doctor, an MD doctor, but she's also an MPH, board certified in lifestyle medicine, obesity medicine, and several other specialties. So she knows whereof she speaks, and what she's going to talk about is when you finally get that annual visit with your primary doctor and you got 15 minutes, how to be prepared to use it instead of just sitting there waiting for them to say something and they don't know what to say to you because you're the 743rd person they've met that day. So I'm really looking forward to this important information. So please, Dr. Spaulding.
Thank you so much for the invitation to be here today. You know, if I lived here, I would be in this club because I am a lifelong learner. So today, what I'm going to talk about is being stronger together, building better relationships with your healthcare team. And I don't have my computer in front of me, so I'm going to be looking at the screen. Occasionally, I will look at you, but I would prefer to look at you. And so I am a physician, and I'm founder of Evity Lifestyle and Integrative Medicine in Henderson. It's a membership-based practice. And for those of you who aren't familiar with lifestyle medicine, it's an evidence-based medical approach that prevents, treats, and even reverses, hold on, let's see if I can get this out. There we go, okay. And so prevents, treats, and even reverses chronic disease. It addresses root causes of disease rather than just symptoms, empowers patients to take an active role in their health and improve their quality of life. And so at Evity, I partner with individuals who have chronic medical issues like prediabetes, diabetes, hypertension, weight gain, and obesity to help them adopt and sustain healthy behaviors in 6 key areas. And those areas include, wrong way. Okay, those areas include nutrition, where we emphasize whole food, plant-based diets, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connection. So I just wanted to tell you a little bit about myself. I'm a graduate of Duke Medical School, did a residency in family medicine at UNC Chapel Hill, and I did an integrative medicine fellowship at the Andrew Weil Center for Integrative Medicine in Tucson. I've had nearly 40 years of experience practicing medicine across academic, community, urban, and rural settings with patients from diverse backgrounds and experiences, and as Juanita alluded to, I'm triple board certified, lifestyle medicine, obesity medicine, family medicine, and I'm also a certified health coach. But probably one of the most important roles that I've played in terms of learning about patient communication is as a patient and a healthcare advocate, particularly for my mother who went through 3 episodes of cancer and so had multiple doctor and hospital visits. So I know a little bit about being on both sides. So today what we're going to talk about are systemic challenges to effective patient-provider communication. We're going to talk about challenges to communications that patients and physicians identify. We're going to touch on consequences of suboptimal communication for patients and physicians, and what patients and physicians are really looking for during visits. And then we're going to do a couple of mock demonstrations. I've roped one of my friends into being a patient, illustrating ineffective and effective communication strategies. And finally, I'm going to discuss the use of a guide that I've developed to help patients optimize communication. And you'll receive at the end this guide free of charge. It's a free tool. And if you want information about the practice, there's some at the back of the room. All right, a few important notes. This presentation is for educational purposes only. So I'm going to provide general suggestions to support better communication between patients and the healthcare teams. This will not constitute medical advice, diagnosis, or treatment, will not create a doctor-patient relationship. And so if you have personal medical questions, please consult your healthcare provider. A few other things. What I'm going to focus on today are ways or tactics to communicate within a 15-minute return appointment with your primary doctor. Now, I know some of you have more than 15 minutes. In my practice, my initial visit is an hour and a half, and all of my follow-up visits are an hour, but that's unusual. I'm probably an outlier. But because most visits in this country are about 15 minutes, that's why the presentation is focusing on that. Note that the principles that I'm talking about can apply to interactions with other healthcare providers, although I'm primarily going to talk about physicians, but the same thing applies to nurse practitioners, to PAs, and then to your specialist physicians as well. I'm going to emphasize what the patients can do, emphasizing what's in their control, although we all know there's a lot that physicians can do, right? And that physicians need to change, but today we're going to focus on patients. And then I'm going to do 2 very abbreviated mock patient scenarios demonstrating behaviors that can hinder or promote effective communication. All right, well, let's talk about the level of satisfaction people have with communication with their doctors. So overall, 64% of patients in primary care settings say that they're very satisfied with their communication. But that means there are about 40% of people who are not satisfied. And so we're going to talk about what those people could do. I don't know which group you guys fall into, but hopefully everybody will leave here and learn something. However, if you look at non-primary care settings, only half people say they're very satisfied with communication. So there's room for improvement. Communication with a doctor is the strongest driver of patient satisfaction. So we really need to get that right. Doctors are half of the equation and often need to do a better job with communication. And frankly, there's not a lot of training in medical school and residency programs on how to communicate with patients, and that really should change. All right, so the focus today is what you can do to improve communication. Well, let's look at some of the challenges to effective communication in our healthcare system. There are high patient volumes with increasing visit complexity, and that leads to rushed encounters. There's short appointment times with multiple competing priorities. And the EHR, or electronic health record checklists and administrative tasks, take attention away from the patient. I don't know if you guys, how many people have been in the room with the doctor and they're looking at the computer rather than looking at the patient? Yeah, so, and doctors actually don't like that. The electronic health record really was developed as a way to bill, not as a way to enhance communication with providers. So, and then often in a doctor's office, there's limited support staff or people feel undervalued, and there can be low morale. And then there's a lack of training and effective communication skills for both patients and providers. How many people have ever been to a course or heard a lecture on how to communicate better with your provider? Okay. Well, good. So you're in the right place. Okay, so the U.S. healthcare system is built for late-stage disease management and not really built for prevention. And then there are high levels of physician burnout. And unfortunately, this may get worse because as the population ages, there are more people with, there's an aging population, but also they have more problems. So we just have to figure out how to make it really efficient for you and for the providers in these situations. So what happens when there's suboptimal communication? I mean, it's not just a question of people walking away dissatisfied. There are also real-life consequences. And there's lower trust and satisfaction with communication, missed or delayed diagnoses, poor adherence to treatment plans, people avoid follow-up care, and there can be worse health outcomes. So those have all been documented with research. And so what are the things that physicians are concerned about in terms of challenges to effective communication? Physicians say that there's constant time pressure to cover too much in too little time. They say that there are too many patients and productivity demands. They don't like heavy documentation and burden associated with the electronic health record. And then, just something for everybody to know, physicians sometimes get frustrated when patients bring in long, raw logs. And what I mean by that is you just bring in reams of paper with like, oh, here are my blood pressures for the past 50 years. So if patients can consolidate that, and we're going to talk about how you can do that. Or if people haven't really thought about their problems and come in with vague concerns. Sometimes they feel that there are unrealistic expectations about how many problems can be addressed in one visit. And then physicians experience, probably about 40% of physicians in this country experience at least one symptom of burnout because of the transactional rushed encounters. And then there's a fear of the malpractice risk when communication breaks down. So for the physician, the impact of this is there are more inefficient visits and incomplete information, strained relationships with patients, higher emotional fatigue and burnout, lower job satisfaction, and increased malpractice claims. So, well, what are people actually looking for? What do they want to see in their visits? Patients say they want respect and empathy, enough time to share their concerns, they want to be listened to fully, they want clear, jargon-free explanations and involvement in decision-making. Physicians say they want clear, organized information from the patients, efficiency and focus on what matters most to the patient, meaningful, satisfying interactions, patients who engage in shared decision-making, and then sustainable workloads that reduce burnout. So just from what I've read, you may have heard that there's some overlap. And the overlap is that they both want clear, respectful communication, enough time to focus on what matters most, trust and empathy, shared decision-making, satisfying and meaningful interactions, and then a partnership to achieve better health outcomes. So what I'm going to talk about today, I've developed, and you'll get it on this card, this is a tool that hopefully will help people to have more efficient but also more meaningful visits with their provider. And this is a card I call to be used by the activated patient. So the patient who goes in there, they know what they want, they know what to ask for, and then they know how to get it. They know, but then they do it before, they're prepared before, they have a specific way of doing things during the visit, and then a way of doing things after the visit. So, all right, let's talk about what this looks like. So before the visit, begin with the end in mind. And what I mean by that is think about what you want from that visit. What do you really want to walk away with? And so, make your list of your top 2 or 3 concerns. And often it helps if you phrase them as questions. So let's say you have knee pain. Well, what do you really want to know about your knee pain? Are you worried about a specific disease? Or, are you worried that the knee pain is gout? What are you worried about? So if you can phrase your concerns as questions, that's really, really helpful. Then write out your symptoms. And I suggest people think in terms of who, what, when, why, where. Now, the who you would think is obvious. Well, you. But maybe it's not you, because maybe if you're going as a patient advocate, it's the person that you're going with. The other part of who is who else is sick. So let's say you have a respiratory illness. Well, be prepared to say, yeah, well, my cousin, my brother, my sister, we all have the same thing. So that's the who. And then the what is really important. Be as descriptive as possible about your symptoms. So let's say that you have elbow pain. Then what you should say is, okay, what kind of pain is it? Is it sharp, dull, achy? Is it only in your elbow? Does it go somewhere else? So the more symptoms that you can give the doctor, that's information. That's really important clinical information. And then the when is, well, when do you have it? Do you have it constantly, or does it come and go? Do you have it only on Friday, when your cousin visits that you don't like? I mean, those are all things to think about. Where is the pain? And you don't have to just use words. I mean, increasingly, we're developing these forms where diagrams, people can locate where the pain is and say where the pain is. So you can literally show the doctor, the pain is here, it goes here, no, it doesn't go that way. That's really helpful information. And then if you have any insight into why you might be having the pain, or if you have questions about why you might be having the pain, share that. Or if there are things that you're concerned about. If you're like, oh my gosh, I've got this knee pain, now I'm worried about cancer because my cousin had osteosarcoma. That's important information. And then get familiar with trusted sources. So you can Google things. There are lots of sources like the Cleveland Clinic, the Mayo Clinic, familydoctor.org. You can put in the Google browser, can you show me trusted medical sources that tell me about diabetes? And it'll show you information from the American Diabetic Association or whatever. Do not copy the reams of paper and then bring them to your doctor and say, okay, you read this. Get what you can from it, and then if you have questions based on what you've read, bring those questions. And then determine how you learn best. Are you a visual learner? Are you a written learner? Auditory? And that's useful information because if you know in advance, if the doctor's explaining something, you can say, I don't understand what you're saying. Can you show me on a model exactly what you're talking about? Or can you show me a website with a picture? So that's really critical that you know how you learn best so the doctor can give you teaching materials that are really geared towards you. And then clarify your comfort with medical language. Have you had trouble before with medical jargon? The doctor talking and you're like, I have no idea what you're talking about. It's just totally going over my head. Be prepared to go and say, hey, wait a minute, can you stop that last word that you used? I'm not familiar with. Can you explain that to me? And then organize and summarize your data. So if you have blood pressure data or blood glucose data, what is really, really helpful, and I'm asking my patients to do this for me now. So if they have high blood pressure, to bring their log, but at the same time to look at their log and say, hey, my blood pressures have been 118 to 130 over 70 to 90. You've saved me like a minute by doing that. So if you have information that you're collecting, be it blood sugars, blood pressure, whatever, it's really helpful if you can summarize it. And then identify a support person, because that person isn't just there in case you have questions and you don't know what to ask. That person can be a scribe, because it's really hard to listen and to take in the information at the same time. And we're going to talk a little bit more about that. And make sure you bring your essentials, your medications. If you're taking supplements, please bring the entire bottle, because often supplements contain multiple things. Doctors don't know what's in one brand name versus another. And if you have any consults or labs from another physician, bring those, because sometimes the electronic health records don't talk to each other. So doctors won't have your lab results from another physician or another clinic. And then bring your calendar so you can schedule your next visit at the desk so you don't have to go through the phone tree and try to do it later. Okay, and then arrive early, and if you have to wait, be prepared to have some calming techniques. It could be knitting, it could be deep breathing or whatever, just so that you don't get aggravated. All right, well, let's talk about what happens during the visit. The first and the most important thing, establish how much time you have with a physician. So you could say, doctor, I wanted to prepare for this visit, and I just need to know how much time are we going to be able to spend together today? Because that's really going to define what you're going to be able to accomplish in that visit. I mean, often what happens is people come in and you start talking, and before you know it, the doctor's looking at their watch, and then they're going to the door, and you're like, wait a minute, I haven't finished talking about the things that I need to talk about. Then you clearly state your priorities, concerns, and your questions. So say, okay, here are my top 3 things I want to talk about. This is the order I'd like to talk about. But then you say to the doctor, what do you want to talk about today? Because often the doctor will have labs or something else to talk about. Then together, you decide the agenda for the visit. And it may be you can't get to all of those things, but the key is you can come up at the end with a plan for how you're going to address the things you didn't get to. Then when it comes time for the symptoms, you could say to the doctor, listen, I've thought a lot about this, and can you give me a minute or 2 because I want to describe to you what my symptoms are without getting interrupted. Because, as we said, or I don't know if we showed the slide, but usually patients get interrupted after between 11 and 23 seconds. So you're telling your story, and before you know it, the doctor's on a different tangent. So say, hey, listen, I've thought about this, I've prepared, I want to tell you this story, short story. Okay, and then communicate your comfort level with medical language, share your learning preferences, and then confirm your plan with Teachback. How many people are familiar with Teachback? Okay, we have some people in the audience that's great. So Teachback basically means once the doctor does the assessment and the plan, then you say, okay, would you mind if I repeat what you said? And it's not a memory test for you, it's not a memory test for the doctor, it's just to assure that you guys are on the same page and there's been clear communication. And we're going to talk about why that's important on the next slide. So at the end, once you've done your Teachback, you have your plan, circle back to anything that was unaddressed. So let's say you didn't get to all the 3 problems on your list, to say, all right, we didn't get to my 3rd problem. How are we going to manage that? Are we going to be able to talk through the portal? Do I need to make another appointment? Can we do a virtual visit? So make sure, all of your concerns can be attended to. You just have to figure out how you're going to do it most efficiently. And then make sure you confirm the timing or the interval for the next appointment. So to say, all right, well, I'm supposed to come back in 4 weeks. So when you go out to the front desk, you can make that appointment. All right. Now, this is about Teachback. So why is that important? Why is that step important? Patients forget 40 to 80% of what they hear in the waiting room, in the exam room. Nearly half of what is remembered is incorrect. So there is a huge communication problem between the doctor sort of telling you the plan and then you walking away. And Teachback dramatically improves accuracy and adherence. And so this has been studied. So this is a really important tool to clarify and make sure that you and the doctor are on the same page. All right. What happens after the visit? You schedule and confirm your next appointment. You clarify lab tests that need to be done. When are they going to be done? Who's doing them? And how are they going to be communicated to you? Is somebody going to call you? Are you going to get them through the portal? You can ask the people at the front desk that. You can also ask for printed summaries of your labs. A lot of times they don't like to give them to you right away. That is your medical record. So anything in the medical record, you should be able to have access to. And in some EHRs allow you to get that information through the portal. So once you leave the office, follow through on the agreed plan to the best of your ability. Keep your log of behaviors and data. You can do that in a notebook. There are apps. There are all sorts of ways to do it. Keep a running list of questions. So for your next visit, you're prepared. And then go back to before the visit, a day or 2 before your visit, and then plan intentionally. The other part that's really important is to provide honest feedback to the office about your experience. I mean, sometimes people think, well, that's just the way it is, that's the way the doctor is. But, you know, I have a friend who was in the room with the doctor, and the doctor was here, friend was behind, the doctor was tapping on the computer and asking questions. And at some point, my friend stopped responding, and the doctor turned around and said, well, why aren't you answering my questions? And my friend said, why aren't you looking at me? And so, you know, doctors do respond to your feedback. Most doctors, you know, most doctors want to keep the patients that they have. All right, so what we're going to do now is do two scenarios. We're going to demonstrate two different mock scenarios. In scenario one, the patient does not use the doctor visit guide checklist. In scenario two, the patient uses it. Remember, these are very abbreviated snapshots of a visit because of the time limitations of this presentation. So this just gives you a flavor for what it might look like. Again, physician behavior leaves something to be desired in both behaviors. I am not on my best behavior as a physician in these scenarios, but focus on what the patient can do to impact the outcome of the visit. So, all right, so mock scenario number one, suboptimal communication. So we have our patient, Ms. Struve, who's age 60, and as I said, I roped my friend, Adonis Struve, who in a former life was a PA, to do this with me. And so this is a follow-up appointment with a primary doctor without using the guide. And she's gonna be seeing me for ongoing management of hypertension, left knee pain that's mild and recurrent. She's having some trouble sleeping. Here are the things I want you to think about. What do you notice about how this visit goes? What seems to go wrong? And from your experience, what could have helped Ms. Struve feel less frustrated during the visit and more satisfied with the outcome? So, let's come up here. Hello? Okay, good.
Talk like this, right?
Yeah, you just talk straight into it. Okay, knock, knock, knock. Hello, Ms. Struve. How are you today?
I'm doing well.
Oh, okay. Allow me to get my glasses, Ms. Struve. I can't see anything. All right, so, well, tell me about what brings you in today.
Oh, well, first I have to tell you just how happy I am that the weather has changed.
Oh, okay.
I love walking out in the neighborhood, planting my fall flowers. It's just great this time of year.
Okay, great. Well, I'm glad that you're really enjoying the weather. Now, my EHR is broken, so I'm just going to be taking notes here, if you don't mind. Okay, so it looks like the nurses recorded a blood pressure of 125/72. Have you been taking the lisinopril?
Yeah, most days I do. Sometimes I forget.
Oh, okay. Have you been checking your blood pressure at home, like we discussed the last time?
Not really.
No?
No. I can't remember. I think I loaned the cuff to my friend, and I just don't know where it is. I have to look for it.
Oh, okay. Well, I think it would be great if you could check it a few times and then, you know, bring in your log. Anything else bothering you?
Yes. My knee hurts. My left knee hurts. Sometimes it swells. Sometimes it wakes me up. A friend of mine told me that she took an injection, and that helped. Do you think that will help me?
Well, you remember you have degenerative joint disease, and there's inflammation in that knee, and that you know, you have osteoarthritis, and you remember that? You remember the X-rays we did last year?
No, I don't remember that. No.
Oh, okay. Well, I tell you what. Let me do an exam on your knee, and then we'll talk a little bit after that. All right. So, I'm healing her knee. No, okay. Yeah, so based on your exam and your history, I think it's your arthritis again. So why don't you go ahead and, you know, just try to take some Tylenol for that?
Can we talk about my trouble sleeping? It started a week ago, and I've had this problem before, and I thought it was indigestion, but my husband takes some melatonin, and I don't know what the brand or the dosage is, but I want to ask you about that.
You know what? That sounds a little complicated, and I would really love to hear more about it, but I'm running a little bit behind, so I'm just going to have to see the next patient. But I tell you what about we meet in 2 months, And right now, I'll order some labs, and then, we'll get back up in 2 months. How does that sound?
Okay. Oh, okay.
Well, it's good to see you, Ms. Struve, and I'll see you in a few months.
Okay. Gosh, I wish we could have talked about my sleep, because I'm really tired about my sleep. And those labs, I wonder what labs and when I need to get this done.
All right. Thank you. So that was scenario number 1. Some applause for my... Okay. So I don't know, what did you guys see? Do you have any observations about what went well or what didn't go well in that scenario? It was a total waste. Yeah. Great, thank you.
She also had issues with her knee, and you can't hear it. My voice? Oh, so as I said before, she was very frustrated. The patient, she wasn't getting the answers to the questions that were needed. She was frustrated over her sleep, her knees. At least have an X-ray for the knee, because a lot of us have had knee replacements. And then you had the audacity to look at your watch rather than looking at her.
Yeah, not very good behavior on my part, I will admit. Anything else anybody noticed? Oh, did you have a comment, Ari? Oh, I saw you raise your hand. Okay, all right, so, well, let's kind of review it from the perspective, oops, I'm going the wrong way. Okay, yeah, so what could the patient have done differently? Well, this patient didn't prepare in advance what her symptoms are, what her goals were. And again, I'm not trying to blame the patient, but again, we're focusing on the patient and what might have made a difference. So she didn't have identified goals, and she really didn't prioritize kind of her concerns. She didn't ask the doctor how much time was available. And then she didn't ask to have a moment to present her narrative about symptoms and concerns. And that's probably because she hadn't thought about it before she went into the office. And then she did not inquire about the doctor's priorities or use shared decision-making to create the agenda. And then there was no confirmed understanding of the assessment plan using Teachback, and she didn't circle back for the unaddressed concerns. So she left the visit and she had questions. Like, why am I having labs? What are those labs for? What's the point of that? So, all right, we're going to do mock scenario number 2. And hopefully, let's see. Here we go. The same patient, follow-up visit, but this patient has looked at the guide and has prepared in advance. And she's coming for the same problems: hypertension, knee pain, trouble sleeping. So the things that I want you to think about: what do you notice about how this visit goes and the patient's level of satisfaction at the end of the visit? And what did the patient do that led to a higher level of satisfaction? So we're going to welcome Ms. Struve back. Okay, so now notice Ms. Struve is prepared. She has her notepad with the notes that she took at home, and she is ready for me. So, knock, knock, knock. Good morning, Ms. Struve. How are you doing? I'm doing fine, thank you.
Before we start, I just want to just go over this. How much time do we have for this appointment today?
We have 20 minutes, and so I hope in that time we can address any of your concerns.
Okay, well, I made a quick list. I hope you don't mind.
Oh, no, please,
And I'll
please,
through
go
it.
ahead.
Okay. I'm
going to write them down as you say them.
Okay. I'd like to discuss my blood pressure.
Okay.
I'd like to discuss my knee pain.
Mm-hmm.
And if we don't get to all of this today, if we could have a plan at the end of the visit.
So just your blood pressure, your knee pain, anything else?
And I'd like to talk about my disruptive sleep.
Okay. So 3 things that you wanted to talk about.
And the 4th thing is I want to know if you have anything to discuss with me.
Oh, okay. Great question. Well, thank you. Boy, you've really prepared, huh? Okay. So I want to review your blood pressure readings and then talk about your medication. And then I want to address your concerns, including what's most important to you. So of those things that you gave me, is there an order of priority?
Yes. I would like to first talk about my knee.
Okay.
Because I have trouble walking.
Okay.
And if there's any time, I'd like to talk about my sleep.
Okay.
Okay. My blood pressure is doing well. It averages between 125/80.
Okay.
And I do take my lisinopril every day after
Great.
breakfast.
Okay, good. Have you had any side effects of the medication, like dizziness or cough?
No.
Okay.
I don't.
Well, I really appreciate you bringing your log, but also going through the trouble of, averaging your glucose. That's really helpful. That's time saving. So no side effects with the medication?
No side effects, no.
Okay.
I'm most worried about my knee. Can I tell you a little bit about it?
Oh, please. Yeah,
Yes.
that'd be helpful.
So it really hurts in the morning. It
Okay.
gets really stiff, and about 30 minutes into this, it gets a little better.
Okay.
Sometimes it's swollen. Sometimes it wakes me up at night. And I've stopped walking a lot because of the pain.
Oh, wow. So sounds like the pain is, pretty uncomfortable.
Yes.
Okay. And have you taken anything for it?
No, I have not taken anything for it.
Okay. Well, that description helps a lot. So let's go ahead and do an exam. Okay. So, based on your exam and then your history, I do think that you have a mild degenerative joint disease.
What is degeneration disease? Can you explain that to me?
Oh, I'm sorry. Yeah, I should have used other language. So, basically, it means that the joint in your knee or the bone in your knee, usually with age, sort of deforms, and then it can cause like bone spurs and problems. But I can show you better on on this diagram if you want.
That would be great.
And explain
That would be
the
great.
whole process.
I think I could understand that better.
Okay. Well, and now that we've done that, so the other thing you mentioned was sleep. Can you tell me more about that?
Yes. I've been having some disruptive sleep for the past week. I seem to go to bed around 9 o'clock with the television on, and then I wake up at 3 o'clock in the morning, and I can't get back to sleep. I think I might be stressed about bills and other things going on in my life. I try not to drink caffeine because a friend of mine told me not to drink caffeine after noon. Maybe I'm worried about my medical bills. I don't know.
Oh, okay. Well, that's useful detail. We're going to sort of speed ahead from the discussion, but at the end, I'm going to recommend, let's start with a few relaxation exercises. I'm learning a little bit about lifestyle medicine and not to always reflexively use medications. Mm-hmm. And so I have some handouts with some relaxation exercises you can do. And then let's also think about turning the television off before you go to bed. Mm-hmm. Do you think that's going to be possible?
Yes.
Okay. And then for your knee, I would like to recommend some physical therapy. Would you be open to that?
Yes.
Okay. And for for the pain, for the times when you have the pain, there's an over-the-counter medicine, a cream called Voltaren. And then I want you to continue your lisinopril and then do your home BP checks twice a week.
Okay, good. So just to be sure, can I say back to you what I think what the plan that you have for me?
Oh,
to
sure.
make sure I've got it?
Absolutely.
Okay. So you want me to continue my blood pressure medicine,
Mm-hmm.
check my blood pressure twice a week.
Mm-hmm.
You're going to schedule physical therapy for me.
Mm-hmm.
I use the cream for my knee over the counter. You're going to give me a handout
Okay.
on sleep and how to relax, and I should turn my TV off.
Great. Perfect. All right. Anything else that we need to talk about?
Oh, yes. Do you think we can make an appointment to talk more about my sleep in 2 weeks?
Oh, what kind of appointment?
A follow-up appointment?
Okay.
Yeah.
Do you want to do that in person or virtually or?
Virtually would be okay.
Okay. Yeah, because I think I have some slots open for a virtual appointment. So I tell you what, let's schedule an appointment for 2 to 3 weeks. I do want you to do the things that we talked about for the sleep, turning the TV off. But if you're not feeling better, go ahead and make that appointment. If you are feeling better, then make sure that you call us and cancel the appointment.
Okay, great. I'm glad we were able to come up with a plan for my issues.
Okay, well, it was so nice seeing you today, Ms. Struve.
Okay, bye-bye.
You have a great week. All right. So what did you guys think about that? I mean, does that seem feasible to do in an appointment? Do you think it could be useful? Do you think it would be a waste of time? Do you think the doctor would be like, what's wrong with you? Why are you doing that? Anybody?
Oh, that's it. I like the redistribution, perhaps, of control of the time.
Right. Yeah, and I mean, that's a great point. That's what this is all about. That's why I call it the activated patient, because you go in there, you have thought about what you want, you know what you want, you communicate what you want, and, you know, doctors pay attention to that. And so I think you're more likely to have the outcome that you want when you know, say what it is that you're looking for. So, yeah, but that's absolutely the point of it, to give patients more control in a situation where maybe, you know, you're not used to being in control, or the doctor has been in control. So, any other comments about that?
Well, the first patient couldn't even remember to take her medication. She couldn't remember where her blood pressure cuff was. She couldn't remember that she had arthritis in her knee. She seemed to be the kind of patient who needed a caretaker compared to the kind of patient who could actually take care of herself.
Excellent point. I think for that first patient, that would be a person who would really benefit from having somebody go to the doctor visit with her. I mean, you know, during my mom's illness, I went to practically every doctor visit with her, and I don't know if anybody's ever had chemo in here. You know, it's hard to remember anything after you've had chemo, and so I would go. My job was to be the scribe and to also, you know, be available to ask questions that maybe she hadn't thought to ask. But if, you know, it could be a friend, it could be a family member, but the idea is to share the burden, and then to also, you know, enlist that person. Let's say Adana went with her daughter, to say to her, hey, listen, can you help her set up a situation where she can take her blood pressure? Maybe have a blood pressure station in the house where she knows all the time where it's going to be. But yeah, that's exactly the kind of thing that people need to be thinking about. And whether or not you have memory loss or not, particularly if you're getting a new diagnosis. You know, if the doctor says, hey, I have some lab results I want to talk to you about, that is the time where it's particularly useful, because if it's information that you may think of as sort of bad news, once the bad news comes out, you know, you're focused on the bad news. You don't remember anything that happens after that. So, any other comments? Okay. Let's see. I think I'm going the wrong way again. All right. So, in summary, this is just sort of a review of the visit guide checklist. Before the visit, begin with the end in mind. Set your goals. Decide your top concerns. Write out symptoms and summarize the data. Bring all of your essentials, including your calendar, to make that next appointment. Enlist a support person. During the visit, clarify at the beginning how much time there is. State your top concerns early. Ask about the doctor's priorities and agenda, and finalize them together. Confirm your understanding using Teachback. Determine the timing for the next visit. Circle back to any unaddressed concerns. And then after the visit, schedule your next appointment, clarify tests, referrals, follow-up, track your progress, and share your feedback with providers. So, in summary, patients and doctors want the same thing. We want respect, clarity, and shared goals. You don't have to have a medical degree to advocate for yourself. Prepare before, speak purposefully and clearly during the visit, and follow through after. The patient-physician relationship is strongest when communication is optimized. So thank you guys for listening. And if you want to learn more about my practice in Health Evity, these are ways to connect. There's a sign-up sheet on the side of the room. You can indicate with a check mark if you're interested in our newsletter that we're going to be starting. I'm going to raffle off a couple of gifts in the back. There's a tote bag and a cup and a journal to keep your blood pressure and all those things in, your questions for your doctor. Or you can sign up if you're interested for a free 15-minute discovery call with my practice. You can access the website through the QR code at the table that's posted there, or you can just visit me at www.healthevity.com. Or you can join me live at the health fair in 2 weeks. I'm going to be doing free grip strength testing. Grip strength is actually one of the ways, it's a risk factor for telling you about your health, about frailty. And so we're going to be measuring that for free, and then I'm going to have some handouts, and then there's a chance to win a wellness tote filled with lots of goodies. So you can please come by the booth and just say hi, and that's it. Any questions? Oh. Oh, let's see, isn't it it's Wednesday, is it the 29th? It's right here, at the Anthem Health Fair. I think does that sound right? Did anybody know? I guess I should have known, but I figure you guys would know, you live here. But
Question.
okay.
Where is your health practice?
So my practice, so I have a one-man show, I'm it, and that is in Anthem Village, so it's right across from the CVS. So I have a membership-based practice. If you go to my website, it's very transparent. I have all the details. So I offer what's called a foundational visit. That's an hour-and-a-half visit where we look at where you've been, where you are now, and where you want to go in the next 20 years. And even before the foundational visit, I ask you to submit several forms, old records, and I review those even before I see you. So by the time I see you, I know a whole lot about you, so we can focus on thinking about, all right, what is your state of health now, and what do you want to change? So that's a foundational visit. That's a 90-minute visit. And then after that, you can sign up for a membership, which includes 5 visits over the course of the year. And these aren't sick visits. These are visits really for prevention, where we work together and I personalize a plan using those 6 lifestyle parameters. So we focus on developing a personalized plan in nutrition, exercise, social support, stress management, sleep, and whatever, depending on what your situation is. And so that's a year long, and that also includes access to a lifestyle medicine program called My Viva Plan, where you can actually track all of those parameters. And then twice a week, I do a really fun 30-minute movement session on Zoom. And so I invite all members to come, and I do a presentation on something for 30 minutes. You could be at the gym, walking on the treadmill. You could be at home doing nothing. You could be outside walking. But the idea, so this next 6-week stretch, we're talking about obesity, but we're looking at it from the perspective of nutrition, physical activity. We're looking at medications. We're looking at stress in obesity, because there's a lot of emotional eating that kind of contributes to obesity. So it's a little bit different from a conventional practice. Just so that you know, I am not a primary care doctor. I work with your primary care doctor. My goal is to spend time with you, educating you, figuring out what you need, and then personalizing a program. And fortunately, a lot of times in conventional medicine, doctors don't have the time to do that. So, yeah. No, my costs are not covered by Medicare. I wish my costs could be covered by Medicare, but unfortunately, Medicare does not pay for hour-long visits. So that's the problem. And that's only part of it. The other part is if you accept Medicare as a physician, then you have to have a biller and a coder and all of these other people working with you to code all those forms. And then that would mean I would be down to 15-minute visits by the time I pay for that additional overhead. So that's really the main reason why I don't accept Medicare. Any other questions? I thought I saw another hand. Maybe not. Okay. Well, thank you guys. We're going to pass out. Anyone who wants one of these cards, we're going to pass them out. And
Are they at the table in the back?
Well, no, we can put them there. Yeah, we can put them there now. And
Okay.
there are also some other free things. There's some bookmarks and some cards. So, yeah.
Well, thank you so much, Dr. Spaulding. Thank you, everybody.